It's about the care that you give and listening to the patients and making adjustments to help them. It's not just about the medicine portion of it. And she said, I had to talk about your mom and the care that she gave my dad and us. And there's nothing that's a more an affirmation that I'm doing what I'm supposed to be doing. I see this girl and I looked at her and I said, I think I know you. I said, I know your dad and your sister. And she said, are you Patty? She hugged me. And, oh, sorry. It's not the textbook and reading. It's that human experience that really made me the nurse I am today.
Hi, everyone, and welcome to New Jersey Nursing Insights podcast. I'm Sue Weaver, and with me is my co-host, Daria Wazek.
We're your hosts from the New Jersey Collaborating Center for Nursing, and we're excited to get right to it. Today, we're chatting about the neuroscience nursing.
That's right, Daria. Today, we're delighted to be joined by Patricia Anthony. Welcome, Patty. But before we dive in, can you introduce yourself to our listeners? Tell us who you are and where you practice.
Hi, my name's Patty Anthony. Thank you for having me. I've been here at JFK University Medical Center, part of HMH, for 30 years in the Neuroscience Institute.
Great. So let's get started. Neuroscience nursing. Actually, that's a new term for me. I always heard of a neuro unit, but neuroscience is a new term for me at least, and it sounds incredibly complex. In your own words, how would you describe or even define what neuroscience nursing really is?
So, neuroscience nursing is a highly specialized field, caring for the complexity of patients with brain, spine, and peripheral nervous disorders or diseases. It's diverse and intricate that it takes us across the lifespan. It's working on the acute side as well as through rehab. So you have children through adults, but there's complexity of care through the critical aspect of it. But we're also looking at rehabilitation.
Wow. So it sounds, like you said, very complex and across the lifespan. What makes it unique, neuroscience nursing, from your perspective? What's unique about it?
So there's so much diversity. So we're not just that bedside nurse taking care of a comatose patient. You're that bedside nurse attending to that critical care patient. So doing rapid assessments, sometimes with neuro, there's quick changes, as well as might be in the IR suite handling a patient in that aspect, or in rehabilitating that spinal cord injury patient. Or the psychosocial aspect, the change in the patient in my field of neuro-oncology, that having a brain tumor or a stroke can change that person and who they are. So you're not just dealing with the physical, you're dealing with the psychosocial aspects of these patients and how they're learning to be a new me.
Wow. I never looked at it that way. That's really interesting. Are there any misconceptions about what a neuro nurse or neuroscience nurses do?
I think piggybacking off of what I just talked about, you don't think about ambulatory nursing. So in our practice here in ambulatory, we have 5 nurses that deal with the outpatient aspect of care. So dealing the daily, day-to-day medication reactions, but in a different aspect as that critical care nurse who's on the floor assessing patients. We're getting to see patients in all different aspects of the need of their care.
Very rewarding. Right?
It is. And I think a lot of times when people think about neuroscience, they're thinking of that critical patient that's coming in, or a trauma patient with a brain injury. You don't think of that long-term recovery process that we're also part of.
Right. Well, when we first met you, you told us about your career, and I was wondering if you could tell our listeners about your career and what sparked your interest in not only nursing, but neuroscience nursing.
So my career started at a young age. I always knew, my father was in the art of caring. My whole family's into the arts. So I'm the art of caring. And so is my dad. And he, at a young age, brought me into how to care for people. He was a very faithful man, and my parents were in that. And he instilled that you had to care for other people. So I knew that I wanted to have a career where I was working with people. And I was hospitalized as a senior in high school. I still wasn't sure what I wanted to do. And it was that student nurse who we sat and chatted, and she gave me such insight, and she gave me good care and said, why don't you come to our open house? And I did. And I didn't look back at choosing my path for nursing. I started out in the operating room, and I met a wonderful neurosurgeon, and he was a great educator. It was the complexity of the cases, the back stories on the patients and what they had that really sparked my interest in neuro. And kind of from there, I just ended up working with his practice, and then began working in the Neuroscience Institute, which was early on. And we here at JFK really were a community hospital that brought in neuroscience and a complex, comprehensive program.
Wow, very interesting. Did you have a mentor other than the neurosurgeon? Did you have anybody else that really helped you on your journey
Yes.
to neuroscience?
Yes. Again, I was in my early 20s, so I met nurses through the chapter of the American Association of Neuroscience Nurses. I was like a sponge. They had so much knowledge. They were in research. They were giving lectures at national conferences. What they brought to me just made me want to learn more. And they were amazing. They were moms. They were just such an inspiration for me to watch and follow. And I still sometimes keep in touch. I was telling you earlier, somebody reached out to me, and they helped me pave the way. And then when neuroscience was, we were a community hospital, but they had a vision that neuroscience was needed in the community. So when they put on Russell Pula, who really had this vision of, a Camelot of bringing, that patient care, research, rehabilitation together under one roof, brought neuroscience, and we developed programs. We have neurocritical care, we have IR neuro, we have so many comprehensive programs, our neuro-oncology program, as well as seizures. We're multifaceted. We're doing some of the best care in Parkinson's, but behind all of that was many nurses that are still here to grow and develop the programs for neuroscience. We were creating policies and doing things that we weren't sure how to do. So mentors became, were part of my colleagues. We hand in hand grew the place together, which, looking back, we really made an impact on neuroscience nursing.
It sounds like you built the program through the years of working there.
Mm-hmm.
Take us through the trajectory, or maybe do you have a patient experience you can share to illustrate that?
It's a couple of, what we talked about, really thinking about patients. There's so many, but it's the patient that might have come in through the ER with a bleed. They had a subarachnoid hemorrhage, they're in poor condition. They go to the ICU, they're monitored, they have an EVD drain. These are things we weren't really doing here. So, they're monitoring the patient, watching that patient, taking that patient to surgery, and then being able to care for the patient post-op, and then downgrading them to, our neuro floor and getting them through rehab. And then on the outpatient side, seeing that patient walk in, when they were comatose, and then letting them be able to go back to the unit to say, this is the care that you gave me. I might not remember you, but my family remembers everything that you did to me. There's nothing greater than that experience.
Oh, wow. But I have to pause a minute. You're using a lot of acronyms. So IR, I know, is interventional radiology, but you just mentioned EVD.
External ventricular drain.
Oh, okay.
So our monitoring devices. So,
all right, yeah. Good.
I know, I laugh at physicians who talk to patients like that. And I'm the one that's going, no, well, this is what that means. And I'm doing the same thing now.
Okay. Is there another name that we used to call that, or?
No, I think it's always been.
Okay. All right. Well, we're all getting educated here.
There's probably, trade names, from a Codman or, the
right.
drainage system that we use.
Yeah. Okay, good. And so tell us what your specific role is now. Are you in neuro-oncology now, or?
I am. I wear dual hats. I have an administrative side for neuroscience, as well as I'm a neuro-oncology nurse practitioner. We actually grew the program here, and we had a lot of wins with clinical trials. It was us and major centers. We made a name for ourselves in neuro-oncology. We were the first center to start. We were involved in both trials with something called Optune, which is a device that's worn on the head. It works similar to chemotherapy, disrupting cancer cells and causing cancer death to cells. But we were the first center to open up, and now it's across, the nation, across the international people are wearing this device. So for this little community hospital, we give really good neuro care.
Wow, that's great. And how did you end up specializing in neuro-oncology? You just explained the many varieties. Was it a patient experience, or what happened that you really found the love in neuro-oncology?
It was the neurosurgeon, Roger County, that I started working with. He helped me fall in love with neurosurgery, and especially brain tumor patients. So when I started working out of his office, the first thing that I noticed was that the brain tumor patient is different. They are dealing with many challenges. It's affecting that person and who they are. They've become a different husband and a different father and a different friend. And, so it was very challenging. And I fell in love with that. And I think my nature was, I need to help advocate for these patients.
Well, thank you. And I like your perspective. I didn't think about it that way, that after somebody has a stroke, they're a different person. And that's so true.
Right. So it's stress on the caregiver as well as the patient. It's very straining.
Let's talk about a particular story, if you could share with us. Could you walk us through a patient experience that stayed with you all these years? And it really resonated with me when you shared how you were inspired by a student nurse and how amazing that is. Can you share a patient experience that truly highlights the importance of a skilled and compassionate nurse in neuroscience?
I can. I feel that there's so many that it's really hard to pick one. And I have two stories that I think are very impactful. And one, her mom still volunteers here, and I see her all the time. But we had a young student, and it was when I was first starting, like my first maybe month of working as a neuroscience here. And she was the valedictorian of her class. She was going to college, and she had this horrific brain tumor. And so just watching the care that she had from ICU and the intense care of having to monitor her and watch her. She had multiple brain tumors, recurrence, and she impacted not just me as the ambulatory care nurse taking care of her, but in the hospital. She was the ICU, the rehab, 3 North, which is our neuro floor. She became part of the family because she was here, and, it was probably almost 15 years that she was part of us. And watching the family, watch her decline, and working with that was very touching. And it's stories like this that make you the nurse that you are. It's not the textbook and reading, it's that human experience that really made me the nurse I am today. And saying that, the more recent story, which just it touches my heart as well, is I had a young gentleman that had a brain tumor. He had 2 daughters in their 20s, and the one daughter would always bring him with her, and she was such a good caregiver. And I hadn't met the other sister, but I had talked to her, and she came in one day and said, "We just took my sister to college." And I said, "Oh," and she was going into nursing. And I said, "Oh, what school?" And turned out to be St. Joseph's. I said, "I just dropped my daughter off there." Well, they ended up living above each other. And the one day I ran into the bathroom at the dorm, and I see this girl, and I looked at her and I said, "I think I know you." I said, I know your dad and your sister. And she said, "Are you Patty?" She hugged me. And, "Oh, sorry, but Sorry. When her dad was at their end of the journey, both daughters were there in the office. And, we talked about end-of-life care. And we spent a lot of time, as does Dr. Landolfi. He's, incredible at this time in this patient's journey. And they both sat there, and it was that point when they realized that they weren't going to see us again. And they were like shocked. And I think that was the realization. And that was impactful to me, that they looked forward to the care that we were giving and that human side of caring. So my daughter, eventually they did meet, and they talked to one another. And Jen told my daughter that, in nursing, they said, what's your experience? And she said, I had to talk about your mom and the care that she gave my dad and us. And there's nothing that's an affirmation that I'm doing what I'm supposed to be doing.
That's really inspirational, Patty. Thank you for sharing that story. Do you know if she's going into neuroscience as well?
I don't know about that, but we did talk to her yesterday because I said I might mention you. And she said, well, let me see it, but I would love for that. But there's a couple stories like that where people who were cared for their parents that have gone into nursing. And I think it has to say something for the care that was given throughout the hospital stay of that patient or their journey.
Great example of the impact that nurses can make as well.
Right.
Now, Patty, you founded the Central New Jersey Brain Tumor Support and Resource Center 30 years ago. That's an incredible legacy.
I started when I was 12.
What was the need you saw in the community that really drove you to create the center?
It goes back to noticing that brain tumor patients were different to me than other cancer patients because they lost part of their self, I was stating before, and there was nothing in the area. So I started small in just the office that I was working in, and we've grown to a pretty large group. We've worked with national organizations, and we've done community projects. So we're a small group that has a lot of power in helping patients. We now don't meet in person. We've been meeting since COVID online, which is mixed because you don't have that human touch and the connections that they used to have where they would go out to dinner and then come to the group. So they connected and made friends with one another and were able to support one another. People that were in the group, they get it. They get what it needs to take care of each other, the patient, as well as themselves as caregivers. Meeting online has opened us up to letting people come and speak from different states or bringing in patients that can't travel. Transportation in New Jersey is not the best. So it's hard to get people here. So having that option's been pretty incredible. Some days there might be 5 people on, some days there might be 25 people on. But if you're hitting one person, that's all it takes.
What has it been like to see neuroscience in your center, your career? All of that evolve over the last 3 decades.
It's pretty amazing, and as I was telling Sue, it really made me reflect and reach out to the other neuroscience nurses that are here. I have memories of being yelled at by our director of nursing, we can't do that on the floor. And I'm like, they are doing this on the floor in other places. We need to evolve, So we've kind of gotten past that. And I think being with Hackensack Meridian, we have neuroscience across the state now. So some of the harmonizing that we're doing and working together and, sharing protocols and not reinventing the wheel, but making things better. Sometimes it's challenging, but, in the end, we're giving patient care across New Jersey.
Thank you, Patty.
So, Patty, I'm still stuck on the story of the nursing student who went to college with your daughter. And I think it really illustrates your caring, genuine caring, and how you develop meaningful relationships with patients. I think it's very empowering to hear that story.
Thank you.
So I wonder, for a few other nurses, student nurses in the field right now who are interested in neuroscience nursing, what piece of advice do you have for them?
I think always asking the why. Why are these patients having the symptoms they're having? And knowing why you're doing something for that patient, really understanding the patient's process. And if you don't know it, asking about it. We just can't do something for doing it. And you have to have compassion and listen to those patients. And one of the things you have to circle back to is listening to the patient and what their needs. We have expectations of this is how the medication works, this is what you need to do, but we still have to listen to the patient. And it's that part of it, making yourself available to listen. And it's tough now, the worrying about documentation and everything else that you don't want to lose why you became a nurse. It's that part of it that we need to keep, and that compassion portion of it. That's why we're here.
Oh, very good. And I remember you said you started your career in the OR. Is there a special unit if I'm just getting my first job in nursing and I know I love neuroscience? Like, what unit would you recommend I work on?
We had an event and I was speaking to a new nurse that is starting out on the unit, and he was part of our education program that we do here. And listening to him speak, but it's, again, asking the why and being that sponge and just absorbing everything that you can. You want to learn the basics first. And I think before even going to the OR, yes, I made that choice. I was on a floor a very short period of time, but understanding the basics and working bedside and knowing the patients and the disease processes, I think is so important, and really having a strong assessment skill.
Patty, in neuroscience nursing, I would think, and correct me if I'm wrong, there would be a lot of changes in technology and patient care.
Oh, yeah.
Maybe more so than other specialties. Is it hard to keep up? Is that something that somebody aspiring to enter this field should be aware of, that they need to especially keep up with?
Yes, yeah. It's ever changing. We have this HIFU now that patients that come in with tremors, it's a high, ultrasound, high frequency ultrasound that treats tremors, and these patients wake up and they don't have a tremor, So we're doing amazing things, and it's lifelong learning. You're constantly need to be educating yourself. There's constant changes. There's new trials, with brain tumors, it was pretty stagnant for many years, but in the last 10 years, we've had a lot of changes. So we have this genomic profiling, and we are seeing longer-term survivors because we're giving targeted therapy. So in 2016, that changed. 2020, it changed. So you have constant learning in all fields across the board with neuroscience. So it is challenging, but if you're willing to take that on, I said, come aboard.
If you could go back and tell your younger self one thing at the start of your career, what would it be?
Not to work so much. My family knows that my brain tumors are my other family. They get it. They've been part of it. They've joined in. I think I would have went back for my nurse practitioner earlier. I waited. I took care of my family, and I had twins, so it was a little challenging. But I wish I went back for my nurse practitioner earlier. But in retrospect, I think I make a difference in patient life. I feel that I'm good at caring for patients and listening and advocating for them. So I don't think I would change that. I think it was, it would make minor tweaks and changes. And people say you've been at a place for 30 years, but, I feel that God puts us where we need to be, and I think I'm meant to be here.
It sounds like one thing hasn't changed is your genuine compassion and caring. Sounds like it's been consistent throughout your career.
I have to agree. That's who I am. I put a lot of care. I make myself available, sometimes too available, but people often ask, what do we do different? We have, our survival numbers look good, and it's not just about the chemo. It's about all of that, the package deal. It's about the care that you give and listening to the patients and making adjustments to help them. It's not just about the medicine portion of it.
This is a great segue to our last question that we ask all of our guests here on Nursing Insights podcast. How do you manage your own self-care? This is especially important, more so just everything that we talked about and how much that you give your patients. How do you fill your own glass? That's
a challenge. We have good people, years ago, I sat with hospice nursing and we talked about it too. And I always ended up navigating towards them because they understood the challenges of brain tumor patients. So a lot of talk therapy with other people that get it and understand. Sometimes the person that runs my support group, Stan, he and I would call him and say, oh my God, I can't give you the specifics, but, I just need a voice of reason on this because I can't believe this is happening. But it's also taking time for yourself, which I find challenging. I do work a lot of hours, but working out, it's not just about, it's about that mind-body, keeping focus away from what you're doing every day. But it's challenging. It's not easy. And HMH has great programs. We have somebody that comes once a month that sits and you can go talk to her, and she's fantastic. And she has become a regular in our department. So it's utilizing resources to stay grounded.
Excellent. Well, I think that's it for today's podcast. We appreciate you taking the time out, sharing these amazing stories, and what an amazing career that you've led. Very inspiring.
Thank you so much. It's been a pleasure meeting both of you and being able to do this podcast.
Thank you.